Okay, good morning, everybody. And we're going to continue our discussion this morning about the circulation, about the circulatory system. And I hope that we will conclude our blood circulatory system and then move on to the lymphatic system as well this morning. So this is where more or less where we ended up last time. I'll just revise this few, tell you exactly what I need you to know. I want you to remember that the fetus in the uterus has a special circulatory system, an entirely self-contained circulatory system, which keeps the fetal blood, the infant's blood, circulating through the infant's body only. The infant's blood does not circulate through the mother's blood circulatory system. The mother's blood does not circulate through the infant's blood circulatory system. Instead, the mother and infant communicate across the placenta, which is a highly specialized organ, which will absorb oxygen, nutrients, etc., and allow them to be transferred into the fetal circulatory system. And that takes place through these special veins and arteries, which comprise the umbilicus, which connects the infant to the placenta. Now, what is special about the infant's blood circulatory system is that it is an open system. In other words, oxygenated and deoxygenated blood are mixed and circulate around the body. This is absolutely fine because it is highly saturated with oxygen from the mother's blood, diffusing across the placenta. This mixing is achieved by various means, but the most important are that the aorta here and the pulmonary arteries here are actually connected. There's a hole. There's not so much a hole. There's a special short blood vessel called the ductus arteriosus, which connects the two to allow blood to mix. And in addition, there are holes in the septa of the heart, so that blood mixes in the heart itself and is circulated around the body. At birth, these all close off. These close off, and the umbilical veins and the arteries close off as well. And as the infant is born, it achieves a closed circulatory system, exactly as it will remain for the rest of its life. We will hear later that sometimes there are birth defects where these remain open. We'll discuss that in a second. Okay, so here's something which is really important to understand something about, and this is your blood pressure. Blood is moved around the body by the beating of the heart, and that beating of the heart is extremely powerful and sets up a high pressure inside the arteries of the body. There is not so much pressure in the veins. The pressure of the heartbeat, of the pressure inside the arteries is dissipated when the arteries break up into the capillary beds. And the venous blood pressure is very, very, very much lower. In fact, you can collapse a vein, even a large vein can be collapsed quite easily by putting pressure on it. And this goes to the functioning of the veins, because the veins operate as pumps. The veins are continually compressed by muscle action and relaxed, compressed and relaxed, and the blood is pumped through the veins by the action of muscles, of the normal skeletal muscles, involuntary muscles, etc. In the arteries, however, there is a much higher pressure, and that is imparted by the beating of the ventricles. The ventricles create a tremendous amount of pressure inside the arteries, and that is reflected in the structure of the arteries. The arteries are built to maintain that high pressure as far as possible, so that blood is distributed to the very furthest points of the body. When the heart beats, when there's a contraction of the ventricles, the pressure inside the vessels in the arteries rises. And that is what we call the systolic blood pressure. When the heart relaxes, when it goes into it, the heart briefly relaxes and repolarizes before it beats again. The pressure, the resting pressure inside the arteries, that is what we call the diastolic blood pressure. And we also, you can actually feel your heart beating if you put your, for example, if you rest your fingers, how can I do this? There on your thumb side of your wrist against the tendons that you can feel there just below your thumb. You can feel a pulse. That is an artery which is running over bone and tendon and stuff. And if you gently press on it, you can feel the heart beating. You can feel this diastolic pulse running through the artery. And this is called the pulse pressure. And it's a reflection of the systolic blood pressure increase as the heart beats. Now, blood pressure is a very, very important parameter of health. And it's important to know your blood pressure, and to also to watch your blood pressure. When you're young, it's seldom a major problem, but blood pressure is carefully regulated by the body as far as possible. And in fact, we'll come to learn a bit later on that the organs, there are certain organs which have particular responsibility for regulating blood pressure. One of the really important ones are the kidneys. The kidneys and coordinated by the brain stem. These are what are principally responsible for regulating blood pressure. So when you feel your pulse, what you're feeling is that systolic beat, and it comes at the same rate as the heart rate. And you can actually feel these pulses, by the way, at many different points around the body. So the ones that you should know, particularly if you're ever involved in a first aid situation, an emergency situation, you need to know the pulse, whether somebody has a heartbeat. With the really important ones are the radial pulse. That's the one I showed you on your wrist, just below your thumb, on the thumb side, and just against the tendons that you can feel running in the middle of your wrist. The other easy one to feel is your carotid pulse. And if you just gently press in next to your windpipe here, underneath your jaw, you'll feel the carotid pulse quite strongly. Remember that these are reflections of arteries which are running. And you'll think back to our diagram of the circulation, the arterial circulation. And you'll remember the carotid arteries, these great arteries that run up the neck to supply the brain with blood. So those are the carotids. But there are numerous other pulse points wherever an artery can be felt below the skin and above some harder piece of either bone, tissue, or whatever. You do not need to remember these, all of these. I would like you to remember the radial pulse, the radial artery pulse there, and the carotid pulse there. But to have a look, you can try out all of these different pulses, see if you can find them. Okay, we'll discuss the normal and disordered blood pressure a little bit later. Let's have a look at some general disorders of the circulation and blood vessels. The first disorders of the heart that fall basically into two categories. The first is congenital heart disease, and the second of it is acquired heart disease. And in the congenital heart disease disorders are very frequently related to failure to close off the fetal blood circulatory system at birth, and instead to maintain some degree of the open blood system which mixes blood. Now, in the fetus, that the mixing of the blood is perfectly fine because all the blood is highly oxygenated. But once the fetus becomes independent, it is very dangerous to mix deoxygenated blood with oxygenated blood and send deoxygenated blood off to the tissues. And this very frequently results in very obvious disorders for the infant when it's born, particularly that they have a distinctive blue color to them. A dark, it's called cyanosis. It's a sign that tissues are being starved of oxygen. And there are various degrees of these disorders of development of the heart. I'll just, don't freak out at this entire diagram. I'm just going to point out a couple of things that can happen. Let me just go back here. And I'll tell you, first of all, the most common disorders are to maintain the infant is born, and this here, the ductus arteriosus, does not close off. That's the one. The other disorder is when the holes in the septa of the heart, which mix blood inside the heart, when those holes between the chambers do not close off, then that also causes mixing of the blood in the infant after it's born. In addition, so for that, the first, when that duct is kept open, that is called a patent ductus arteriosus, a very common congenital defect, by the way. Then if there are holes between the chambers, holes through the septa of the heart, those are septal defects, or hole you may have heard them referred to as a hole in the heart. And that allows mixing to take place, for instance, between the left and the right ventricle, which would be mixing of deoxygenated and oxygenated blood. Then another really amazing defect is called a transposition. And that's this diagram here. And I just want you to have a look carefully and see try and remember what happened in the normal heart. In the normal heart, we had the superior vena cava, came in, and it emptied into the right atrium, and then into the right ventricle. And that then went off to the pulmonary arteries, right? Well, here we've got what is called a transposition. The aorta and the pulmonary artery are swapped around. Very, very strange, but it happens. And if you have a look now, what happens in the circulation, here's the superior vena cava. Here is the atrium. Here's the right ventricle. Right ventricle beats, and look what it does. It sends deoxygenated blood straight out through the aorta to the body. It's recirculating deoxygenated blood over and over and over and over again. This can be fatal. This can be a fatal error. Have a look on the other side. Here's the left ventricle. Okay, here comes the pulmonary veins delivering what is supposed to be oxygenated blood. And what does it do? It sends it out through the pulmonary artery back to the lungs. So what happened here, we've separated the deoxygenated blood and the oxygenated blood, but we're circulating oxygenated blood over and over and over again through the lungs. We're circulating deoxygenated blood over and over and over again through the body. These infants with this disorder very frequently survive, however, because they have holes in the septa as well, and they very often have a patent ductus arteriosus. Here it is here, PDA, patent ductus arteriosus, and then they have holes in the septa, which allow enough mixing of blood like this to send some to send oxygenated blood out through here. It's a very, very dangerous and situation. But believe it or not, this is reparable. Very frequently, it is reparable through surgery. And surgery can be performed on the infant's heart to actually repair this transposition and restore normal functioning. So the next disorder that I want to talk about is a disorder of, particularly of the great arteries, where the arteries are under tremendous pressure. And this is called an aneurysm. It's a defect of the arterial wall in which the thick muscle layer inside the artery fails, and the outer endothelial layer, the outer connective tissue is also weakened. And what happens is that the endothelial tissue bulges out through the muscles below the connective tissue, and it forms a great balloon. This is extremely dangerous because this is very weak. It is still subject to the pressure of the heartbeat, pounding of the heart, and it can burst at any time and cause a fatal hemorrhage. These aneurysms can occur on any artery, but they are commonest in the aorta, especially in the abdomen here, sometimes at the arch itself there, but they also occur in the brain, and they are a common cause of fatal brain hemorrhage. They often are pretty much silent. They don't produce many symptoms until they actually really balloon out so much that they burst and cause a hemorrhage. The next set of disorders are ones which you will very frequently hear of, particularly in regards to general health, and especially in the health of the aging. As you get older, you become much more susceptible to these. And these are disorders where the blood vessels become narrowed, especially the arteries, become narrowed. Any narrowing, thickening and narrowing of a blood vessel like that is called a sclerosis. So sclerosis refers to the thickening or narrowing. When it's in an artery, it's called arteriosclerosis. And arteriosclerosis is a particular set of disorders which are associated with aging. And they are, it's simply the vessels begin, especially the connective tissues begin to thicken, and the vessel narrows just due to wear and tear, due to all of the thousands upon thousands of heartbeats that artery has sustained during the lifespan of the person. So arteriosclerosis is just ordinary narrowing of the arteries. There is another type of sclerosis called atherosclerosis. And atherosclerosis is narrowing of arteries. It can happen virtually at any age, in actual fact. It does get worse as you get older, but it can happen at any age. And it's due to deposition of lipids, of fats, inside the lumen of the artery against the endothelium, which is the lining of the artery. And this is strongly tied to two things, and that is to genetics and to diet. And it appears that if you have a diet which is very high in lipids, you are more susceptible to laying down fats against the artery wall. And one of the great problems with that, not only is there an inherent narrowing of the artery because of the fat filling the lumen, but it also provides a place where platelets can begin to settle. The blood is slowed as it passes past these narrowings, and there's a danger that blood will begin to clot where the narrowing occurs. And in addition, as these clots themselves age, the body begins to calcify them, begins to lay down calcium salts inside the narrowing, which makes it even worse. These narrowings cause various problems depending on where they occur, depending on exactly which artery it is, to what organ they are running. For a start, these are quite common in blood vessels leading to the brain. Excuse me. So in blood vessels leading to the brain. And their presence is often given away because there are temporary losses of blood pressure to the brain, which cause the brain to suddenly stop functioning for a little short time. And this is called an ischemic attack. There it is there. An ischemic attack is one where the brain is suddenly deprived of oxygen for a short time, and often the person will pass into a brief period of unconsciousness, which they then come out of. And this is a sign that there's something serious is happening in the blood supply to the brain. If that blood vessel becomes entirely blocked, either by the narrowing itself or very frequently by a blood clot which forms there, then the tissues of the brain may be deprived of oxygen for so long that they are actually permanently damaged. And this is what we refer to as a stroke. This is one cause of stroke. And that is this occlusion of the blood vessel. So that is called an occlusive stroke. It is the result of blocking of the blood vessel. There's another kind of stroke that arises, for example, from an aneurysm. If a stroke which results from a blood vessel bursting due to an aneurysm, that is a hemorrhagic stroke. So these are extremely serious situations which need to be dealt with medically as soon as symptoms arise. In the heart, we're particularly concerned about the coronary arteries. And we discussed this briefly before, that if we have a narrowing of the arteries of the heart, we begin to deprive heart muscle of oxygen. And what results is effectively that the heart muscle begins to suffer damage, and especially it begins to cramp, which causes intense pain. And that when it's simply a narrowing of the artery, that it can result in this condition of angina. If the coronary artery becomes blocked entirely and heart muscle is deprived of oxygen and dies, that we call a myocardial infarction. There are also occasions when there is narrowing of arteries to particular organs. And one of them that happens is if the kidneys are affected. Now, I told you before, kidneys are closely concerned with regulation of blood pressure. And one of the symptoms of atherosclerotic attack on kidney vessels is if the person begins to suffer from what is called morbid hypertension, that is very high blood pressure. Hypertension is high blood pressure, and morbid hypertension is high blood pressure which does not respond to normal medications for regulating blood pressure. You can also have narrowing of arteries to the limbs. And this causes what's called peripheral vascular disease. You begin to get symptoms, particularly numbness and pain and cramping of the periphery of the body, in the fingers, the toes, the feet, those areas. I have mentioned several of these before. When a clot forms in an artery and begins to travel, we refer to that as an embolism. There are also other sorts of embolisms. You can also have a clot of fat which travels through the arteries, also an embolism. Varicose veins are simply, you think back to the structure of the veins and how they work. Veins are under a low pressure and they are collapsed easily, and they are compressed and relaxed by the action of muscle around them, which pushes blood through them because there are valves which direct the flow of the blood. One of the unfortunate consequences of us being upright, a unique thing in the animal kingdom, we walk upright on two legs, and as a result, we put a tremendous amount of extra pressure on the veins of our body, especially in the lower part of the body. And it happens that in some cases, those valves in the veins begin to fail, and they allow blood to pool, to move backwards down the vein, and to balloon the vein. And this appears as swelling of the veins, which we call varicose veins. When they occur in the rectum and around the anus, exactly the same things. They are called varicose. The varicose veins in the legs can appear in the lower part of the gut, and they are recorded there as hemorrhoids, but they're just varicose veins. And in addition, quite frequently, a very frequent manifestation is in men that they have varicose veins lying close to the testicle, and that is called a varicocele. Varicose veins, hemorrhoids, varicocele, these are usually, if anything, a nuisance, but severe varicose veins, particularly in the legs, need to be carefully watched because of this pooling of the blood in the varicose vein. The blood can clot, and that can lead to problems, particularly if that clot begins to move. I've described to you a cerebral hemorrhage, and I'll just here mention, because we're going to talk a little bit more about blood pressure, I'll just talk about cerebral hemorrhage. Again, I told you this occurs particularly with bursting of blood vessels. Aneurysms in the brain are a particular risk, but a contributing factor to cerebral hemorrhage is high blood pressure. And we're going to hear more and more now about the impacts of high blood pressure. High blood pressure is also called hypertension, and is very often referred to as a silent killer. The reason for that is that high blood pressure has very few symptoms associated with it. People with even extremely high blood pressure are often completely unaware of the fact that they have high blood pressure, but that high blood pressure, continual high blood pressure, is putting enormous strain on the vessels of the circulatory system, and especially on the heart. If the systolic pressure in particular is very high, the heart has to beat against that. So, and just think of it this way: if you have a diastolic pressure, which is constantly high, then the heart has to beat against that. If you have high systolic and diastolic pressures, the heart is having to work much, much harder, and is also putting tremendous strain on the structures, especially of the arteries of the body, this continual high pressure. Now, the normal blood pressure is about 120/80. Many people will record lower than this. They'll record about 70, around about there is absolutely fine. So the normal blood pressure, we look at about 120 for systolic and 70 to 80 for diastolic. That would be completely normal. People often go for a very long time with just slightly elevated blood pressure. That elevation of blood pressure can be due to many things. It can be due to genetics, that's the first. It can be due to lifestyle, high stress, for example. When your sympathetic nervous system is continually buzzing and preparing you for fight or flight, when in fact you don't have to flee from anything except your exams and the stress of fighting with your spouse or your partner, all the rest of it, constantly. These kind of stresses lead us to a situation where we maintain a continual condition of vigilance, and our blood pressure is elevated continuously. Very often people go for a very long time in this state where the blood pressure is just slightly elevated, 120 to 130 and 80 to 80. This is something that you really need to watch. And that is the diastolic pressure. Because this systolic here is perfectly acceptable. This diastolic pressure here, remember, this is the resting pressure. This is the pressure against which your heart has to work, because your whole arterial system is being kept at that higher pressure of close to 90. Hypertension is diagnosed in two stages. The first is when your systolic pressure moves above 140 to 159, and your diastolic, I would say systolic 140 to 159, or diastolic above 90, or both. Then you are stage 1 hypertensive. And this is now moving to the point where treatment begins to be recommended. At stage 1, very often, will respond to lifestyle changes. The first one that they will recommend to you, if you are here, is to reduce your salt, reduce the salt intake. The reason for that is a high salt intake induces your kidneys to put fluid into your blood circulatory system. The kidneys respond to high salt by inducing fluid to pass into your circulatory system. Just think what that's doing. You're increasing your blood volume in a set volume of blood vessels. If you're increasing the volume in blood vessels, you are going to increase the blood pressure. So the first thing that is recommended is reduce the salt intake. The second thing that is recommended is reduce your stress. Reduce the stress. Relax. Do things that you enjoy, which will stimulate your parasympathetic nervous system. Number 3, exercise, 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 exercise. If you exercise, you effectively train your circulatory system. You train your circulatory system to rise, for your blood pressure to rise appropriately when you're exercising, and to return to a good resting rate when you stop exercising. So those 3 things. If you move to this stage here, then there are very effective medications which can be used to reduce the blood pressure. These stage 2 here, 160 and anything over 100, 160 for systolic, anything over 100 for diastolic. This is dangerously high. And somebody who maintains this for any length of time is at grave risk of some adverse outcome, cerebral hemorrhage, something like stroke, heart disease. These are all likelihoods in anybody who has a blood pressure like this. The last lifestyle change, which was be recommended for any of these pre-hypertensive or these hypertensive states, stop smoking. Smoking is one of the major contributors to high blood pressure, to hypertension. Fortunately, these days it is much less common, but I know that I still in every class have a group of students who smoke. And what you're doing when you smoke, as soon as you have a cigarette, what you're doing is you are inducing a period of hypertension. Because what happens when you, the effect of nicotine is to cause all the peripheral blood vessels to contract. The muscles in the blood vessels actually contract like this. That is a response that you also have when you're extremely anxious. Because what your body needs, your sympathetic nervous system takes blood from the periphery and it directs it into the core of the body and to the brain. You're raising the blood pressure in the rest of the body prodigiously. And every time you smoke, every time you have a cigarette, you're doing that. And your blood pressure in the end does not return to a normal level. Instead, it moves into a pre-hypertensive state. And then if you continue to smoke for many years or you smoke heavily, you will move into hypertension purely due to smoking. Purely due to smoking. It's a very, very dangerous thing to do for your cardiovascular system. Some other disorders of the blood vessels, a little bit more detail on some of them that I've told you about. I've told you about transient ischemic attacks. Ischemia is this temporary loss of function due to temporary impairment of blood flow. And these are often, you'll see them referred to as TIA, and that is transient ischemic attack. Transient ischemic attack is often a warning sign that stroke is imminent, and so that is why they are of particular interest. Now, transient ischemic attacks can also arise because of narrowing the blood vessels, but they can also arise because of a condition called hypotension. High blood pressure is hypertension. Hypotension is low blood pressure, much less common, but it can be extremely bothersome and can impact quality of life tremendously. And that hypotension is blood pressure less than 90 for systolic, less than 60 for diastolic. And it's, you can imagine if there's low blood pressure, the circulation of oxygen-rich blood to the body, especially to the periphery, becomes impaired, and that may have various effects, amongst which is transient ischemic attacks not due to narrowing of the blood vessels. The other thing which we need to maybe do a little bit more detail on, you'll often see this phrase referred to, especially in sudden death situations. They may report in the paper or whatever that somebody had a cerebral vascular accident, a CVA. A CVA is any major interruption of blood flow to the brain long enough to actually cause damage, and very frequently which will result in death. The commonest CVA is stroke, and that is due to either, that is loss of brain tissue and loss of brain function due to severe impairment of blood flow, either because a blood vessel burst in a cerebral hemorrhage, or because blood flow was stopped due to narrowing, to occlusion, to closing of a blood vessel, either by narrowing or by a clot itself, and it's usually by a clot, by a blood clot forming there. And this we'll call stroke. But remember that stroke has those two causes, either a cerebral hemorrhage or a clot which stops blood flow. Either way, brain tissue is going to be deprived of oxygen and is going to die, and it will be severely damaged. Stroke is very, very common. It is a common cause of disability and of death. 750,000 deaths a year in the United States due to stroke, due to either cause, and 160,000 deaths, 750,000 cases, sorry, 160,000 deaths a year. It's a very common cause of illness and of death itself. Now, the issue of what is happening to the brain when in a stroke. What is happening is that the blood flow is being interrupted. And that is a situation we also refer to as being hypoperfusion. And hypoperfusion can be due to various reasons. The commonest reason for hypoperfusion is hemorrhage. So either in a cerebral hemorrhage, what is happening is instead of the blood making its way all the way to the brain tissue, a blood vessel has burst somewhere and the blood is pooling there and not moving any further. So that would be localized hypoperfusion. The hypoperfused tissues, deprived of oxygen, deprived of nutrients, and deprived of the cleansing of their waste products, are very, very soon damaged. Brain tissue within 5 minutes begins to die. But we can have a generalized hypoperfusion as well. And that is a massive loss of blood pressure throughout the body. And I will just mention that there are two. This is also called, this is what is also called shock. Shock is not some psychological situation, but physiological shock is the condition of hypoperfusion of the whole body. The blood pressure drops catastrophically throughout the body. And there are two main causes. The first is massive blood loss. If you lose blood due to severe wounding, you're simply losing blood volume. The heart carries on beating, but it doesn't have the blood to move around to establish the blood pressure. A certain amount of blood pressure is essential because that is what gets the oxygenated blood to the tissues. If the blood pressure drops too low, that is a situation of hypoperfusion or shock. There is a second major cause of hypoperfusion, and that is a situation called anaphylactic shock. And this is an allergic response. And it's a response where all of the blood vessels in the body actually dilate. All our blood vessels are subject to constriction and dilation because of the muscles inside their walls. And in anaphylactic shock, all of the blood vessels dilate throughout the body. They all dilate, and because the volume of the whole blood circulatory system increases, the blood pressure drops catastrophically. And so anaphylactic shock is another cause of hypoperfusion. All right, just give me 1 minute, please, because I want to just move on to something else. And that is this. Okay, sorry. Okay. So that concludes our discussion about the blood circulatory system, the arteries, the veins, the capillaries, the heart, etc., etc. What you may not know is that we actually have another circulatory system. And this circulatory system is called the lymphatic system. And it's almost as intricate in its structure as as the blood circulatory system. And in many ways, it parallels, it runs together with the blood circulatory system. But it is extremely extensive, and it extends throughout our body. The lymphatic system has various functions. The first thing to know is it is kind of a bridge between our tissues and the blood circulatory system. It transports a specialized fluid. It's the serum. It is serum which is derived from the blood. Once it enters the lymphatic system, we refer to it as lymph, but it is derived from the serum. It's derived from our blood plasma. And it has two major functions. The first is that it hosts many of the elements of the immune system. And it transports things from the tissues to specialized areas of the lymphatic circulatory system, where the lymph is actually kind of examined. And it's examined for the presence of pathogens and things like that. The second thing it does, really surprisingly, is that it transports lipids. It transports lipids and fats derived from the gut, transports them around, and it dumps them into the blood circulatory system. So to get an idea of how it works, let's just think for a minute about how it interacts with the blood circulatory system. So remember I told you that the arterial blood is sent out to the body under high pressure. That's the systolic pressure, right? Is high. The arteries subdivide as they need to move out into the tissues to supply the tissues with nutrients and oxygen and everything. The arteries begin to subdivide. They divide into finer and finer vessels. The finest vessels eventually are called the arterioles. The arterioles preserve the entire structure of the artery. They have the three layers and the muscle and everything else. Cut them in across, they look just like miniature arteries, which is exactly what they are. And they maintain a high blood pressure. As they get very, very fine, however, remember that the structure of the blood vessel changes. And the outer two layers of the blood vessel are lost. And in the capillary beds, there is only endothelial tissue, these thin-walled tubes. This means that as the blood pressure comes down, it effectively reaches what is almost like a blockage. These capillary vessels are so fine and the pressure behind them is so high that in fact fluid begins to leak out of the capillaries. It filters out of the capillaries. It may take with it as well various salts and nutrients and things like this. And it begins to bathe the cells of the body with a clear straw-colored fluid, which we call, when it's around the cells, we call the interstitial fluid. So this interstitial fluid bathes the cells of the body. As it moves around in the tissues, it also begins to pick things up. If there's an infection of any sort, whether it's a bacterium or viruses or whatever, it begins to be circulated with this interstitial fluid. And there is another set of vessels that interlace with the capillaries of the blood circulatory system. And these are called the lymphatic capillaries. I'll show you their structure in a minute. But here they are here, all interlaced with these capillaries in the capillary beds. So what do we have? We have the high blood pressure. The pressure is dissipated here in the capillary beds. And one of the ways it's dissipated is to reduce the volume of fluid by allowing serum to leak out. And that the blood, of course, moves into the venous system and back to the heart. In the meantime, some of the blood volume has been lost. And that blood volume is the interstitial fluid flowing around here. That interstitial fluid now moves into these lymphatic capillaries. Once it enters there, it's referred to as lymph, L-Y-M-P-H, lymph. And the lymph, it moves through a very extensive, as we'll see in a minute, a very extensive circulatory system, which parallels the blood circulatory system. Eventually, this lymphatic system actually empties back into the venous system. So it restores the full blood volume before the blood reaches the heart. Effectively, what the body is doing is it's temporarily taking some of the blood volume, some of the fluids that make up the blood, bathing the tissues with it, then recovering it and processing it and sending it back into the circulatory system. So our first stage of this lymphatic circulation is the creation of this interstitial fluid. It's just a pale yellow kind of fluid. It is referred to either as interstitial or intercellular fluid, and it flows around all the cells. And once it enters the lymphatic system, it is referred to as lymph. Now, the lymphatic vessels can be quite large, but there's no pumping system like a heart, like a lymphatic heart or anything. Instead, they work much like the veins worked. Here's a lymphatic vessel here. It has a very particular structure. The lymphatic capillaries have these flattened cells which overlap one another like this, and there are gaps there. This actually acts like a valve, and this capillary here kind of sucks up the intracellular fluids, kind of sucks them up by this valve, the presence of this valve. The lymphatic vessel, like the vein, works by being compressed and relaxed by muscle action around it. Either voluntary muscles, we've got many of our lymphatic vessels in our limbs operate every time you contract and relax your muscles, and through the body, in the abdomen, in the thorax by breathing, in the abdomen by the continual action of your gut. These lymphatic vessels are continually compressed and relaxed, and they have valves in them, rather like the veins, to direct the flow of lymphatic fluid in one direction, and that is towards the heart. So all the lymphatic fluids move towards the heart. Taken in through these slits in the walls of the capillaries, moved through the lumen of the lymphatic vessels by the fact that there are these valves which direct the flow of the fluids. Oh, sorry, I should have done this. Okay, so that's not all. The lymph doesn't simply flow back up and get dumped into the heart. Instead, interrupting the lymphatic circulatory system at various points along it, there are small organs called the lymph nodes. And these are scattered throughout the body, often grouped together in particular places. For instance, one set that you may know of is underneath your arm here. There is also a set in the groin. There are sets here throughout your gut, all over the place. We'll see how they're distributed in a minute. And the lymph flows to these lymph nodes. They have a very complex structure. We're not going to discuss it in great detail, but I will just tell you that inside the lymph nodes, there are grouped various elements of the immune system, and various cells that pertain particularly to the immune response. The lymph picks up information from the periphery. It picks up information as the fluids circulate around our cells. They pick up pathogens, for example, and they also allow a passageway for cells of the immune system, which are surveillance cells, to make their way to the lymph node. So the lymph is carrying immunological information, and that information is divulged here in the lymph node. And it's here in the lymph node that our immune response is generated. It's in this lymphatic tissue that the immune response is generated. This hugely important function is solidly tied to this lymphatic circulatory system. And that's why we need to know something about it. So in summary, here's our blood circulatory system. Our blood circulatory system, as the arteries move through capillary beds, the pressure inside the capillary bed causes interstitial fluids to leak out, to bathe the cells. This interstitial fluid picks up elements like pathogens, debris from damaged cells, all sorts of things, and enters the lymphatic circulatory system through the lymphatic capillaries. It's conducted by lymph vessels. It's on its way back to the heart to be dumped back into the blood circulatory system, but on its way, it passes through the lymph nodes, and in the lymph nodes, the immune response is generated if one is needed. Okay, so, and we'll leave it there for today, and we'll try and complete this in our next class, and we're then going to move on to a brief discussion about exactly what this reaction inside the lymph node is.